case of irregular period, there are factors that can affect your menstrual cycle, and when they do, that can result to irregular period or irregular cycle for you. Number one is hormonal issues. Hormonal imbalances, especially in your estrogen and progesterone level. When your estrogen and progesterone level is imbalanced, that can result to irregular period or irregular cycle, which will manifest as missed period, heavy period, or unusual short period for you. Examples of this hormonal imbalance, we have polycystic ovarian syndrome, where the androgen hormone, which is meant to be more in a male, becomes more in a woman's system with a cyst attached to the ovary. Okay, we also have hypothyroidism. When your thyroid, they are underactive, okay, they can disrupt the hormone, thereby resulting to irregular cycle or irregular period for you. We also have the perimenopause. When a woman is approaching menopause, okay, there'll be fluctuations in her hormone, and this can also result to irregular period. We also have what we call primary ovarian insufficiency. This is when your ovaries are not functioning the way they should function. Number two is stress. Stress can disrupt your menstrual cycle length by affecting some certain hormones, particularly the cortisol. Okay, and when this happens, they will interfere with some essential hormones that are necessary for ovulation and menstruation. And when this happens, this can result to irregular period. Three is diet, the kind of things you eat. Okay, if you're eating the kind of food that does not provide the necessary or the essential nutrients that are needed for the production of hormones, this can result to irregular cycle or period. Four is excessive exercise. Over exercise, it is okay for you to exercise mildly, but when you indulge in an excessive exercise, your body will sense it as stress, and when the body senses it as stress, it will affect your hormone, and this can result to irregular period or irregular cycle. Number five is being overweight or underweight. If you are overweight or you are underweight, especially when you're restricting diet, like someone that is underweight and somebody that is obese, these two things can affect your hormones, and when they do, this can result to irregular period or irregular cycle for you. So it is essential you maintain a healthy weight. Last one, which is number six, is infections. Infections like PID, if left untreated, that can also affect your menstrual cycle, and when it does, it is also going to cause irregular period or irregular cycle for you. Here are examples of irregular period or irregular cycle. Number one, if your cycle length is fewer, that is, if it is less than 21 days or it is more than 35 days. Number two, you can stay for 3 months or even more without menstruating. Number three, your period flow is extremely heavy or extremely scanty. Number four, your menstrual flow lasts more than 7 days or less than 2 days. You are seeing your period for either 1 day or even half day. Number five, the menstrual cycle length varies with more than 9 days. Let's say, for example, your menstrual cycle length was 21 days the last month, and this month you're having 29 days cycle length. Number seven is spotting or bleeding between period. You know what that means? Let's say, for example, you're expecting your menses next week. This week you start spotting, and small blood will be coming out. The moment it stops, the real menses will now resume. That is spotting or bleeding within period.